If you've had Medicare for a while, you probably assume your doctor bills are predictable. But there's one Medicare rule that allows certain doctors to legally charge more than Medicare approves. And most people don't learn about it until after the bill arrives. Now, this isn't fraud, and it's not a billing mistake. It's called Medicare Part B excess charges. And whether it costs you nothing or comes straight out of your pocket depends entirely on the choices that you may have already made. So stay with me, because once you understand this rule, it becomes easy to avoid completely. Hi, I'm Matthew Clausen with MedigapSeminars.org. And we're going to break this down in a very easy to follow format. When a doctor accepts Medicare, they must choose how they participate in the program. More than 98% of the doctors who accept Medicare are participating providers. That means they accept Medicare assignment. Medicare sets the price, and that price is considered payment in full. The doctor cannot charge you anything extra. Of course, that still means you may pay a deductible or a co-insurance. The medical provider will bill Medicare directly, and then Medicare pays them directly, and Medicare automatically forwards the claim to your Medicare Supplement if you have one. And that takes you out of the picture completely, so you have no concerns about the medical bills, and that is by design. It's all done for you automatically. It's all done for your doctor automatically. It's simple and predictable. But a very small group of doctors, less than 2% nationwide, choose to be non-participating providers. These doctors still accept Medicare patients, but they do not accept Medicare's pricing as final. Under Medicare rules, they are allowed to charge up to 15% more than the Medicare-approved amount. And that additional 15% is called a Medicare excess charge. And in a moment, I'll show you exactly which types of doctors are most likely to charge an excess charge. It's not exactly random. So a quick note, if this is already helping clarify things for you, go ahead and give the video a like, please. It helps me, and it helps YouTube show this explanation to people who may benefit from it just as much as you will. Most excess charges are not huge. According to Medicare, the average excess charge is about $50. But here's the problem. They're unexpected, they're confusing, and they're frustrating. And because they're legal, disputing them usually goes nowhere. To most people, an excess charge looks like a billing error. And when you don't know the rule exists, you don't know whether to question it or just pay it. And that's why understanding this before you see a bill matters more than trying to fix it afterwards. At this point, you're probably wondering, how do I know if my doctor can do this? How do I know if they can charge an excess charge? There are two reliable ways to find out, and one common mistake that I strongly recommend avoiding. So easy way number one, it's Medicare.gov. Go to Medicare.gov and search for your doctor under the providers and services. If the listing indicates that the doctor accepts the Medicare approved amount, they accept assignment and cannot charge an excess charge. If the listing says the doctor may charge more, then they are non-participating and excess charges are allowed. Now, a quick warning, Medicare has changed the warnings, the symbols, the wording, and all of that many times over the years. So don't memorize icons or colors, but do instead focus on the meaning. Does the doctor accept Medicare payment as the full amount, or may they charge more? So this is the most practical rule to remember. If a doctor is allowed to charge excess charges, Medicare will not pay them directly. Medicare pays you, the patient. That means the doctor typically asks you to pay the full bill up front. Then you must seek reimbursement from Medicare and from your supplement. So if a doctor asks for full payment before the services are rendered, that's your signal. At that point, you still have a choice. You can proceed or you can choose a different doctor. And later in this video, I'll show you where and when this situation is most likely to come up. Now, what I do not recommend is to do not call the doctor's office and ask whether they charge an excess charge. Most medical offices do not handle their own billing anymore. Front desk staff are not usually trained on this, and you'll often get an incorrect answer that creates more confusion than clarity. There are several situations where excess charges simply don't exist, and this is important. So first, if your doctor is a participating provider, excess charges are not allowed. Second, if you're enrolled in a Medicare Advantage plan, that pricing is governed by the Medicare Advantage plan network rules and not Medicare excess charges. So there are no Medicare excess charges with a Medicare Advantage plan. And third, some states have banned excess charges entirely. Those states include Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. So in these states, excess charges are illegal. Non-participating doctors must accept Medicare pricing, and the 15% excess charge rule simply doesn't apply. If this is the kind of Medicare explanation you've been looking for, then let me know that I've earned your subscription by clicking the subscribe button below. Every video here is designed to help you avoid surprises before they show up as bills. Now, there are only two reliable ways to eliminate excess charges exposure. And the first is knowing your doctor's participation status before you go on an appointment, using the methods that we've just discussed. And the second is choosing a Medicare supplement that automatically covers or pays for excess charges. When that coverage is in place, excess charges become a non-issue, except for paying the upfront services. You may still need to pay upfront and submit paperwork, but the cost itself is covered. And that's the real takeaway. This isn't about fear. It's really about predictability. It's about being aware of what is happening ahead of time so you're not caught off guard and frustrated by the situation. We've had many people call in that forgot about excess charges. They look at it, they're frustrated, they think they're being overbilled or there's an error, etc. And it doesn't happen often because excess charges are very rare, but when it does happen, it's very frustrating. So let's look at who actually charges excess charges. I mentioned earlier that less than 2% of doctors choose contracts that allow them to charge an excess charge. So who are these doctors? Well, first, let me clear up a major misconception. I know of no major hospital system that currently charges excess charges. Excess charges cannot come from an institution like a hospital or medical facility. And keep in mind, there are no Medicare Part A inpatient excess charges. There are only Part B outpatient excess charges for select services. Now, in recent years, analysts cited by the Medicare Payment Advisory Commission and GAO, the Government Accounting Office, their reports show that only 0.2 to 0.4% of Medicare claims include an excess charge. That means that most people will never receive a Medicare Part B excess charge ever. Now, that said, they seem to be mostly clustered in some parts of the country, like I know in California, Southern California, I think, and in South Florida. Those are places where excess charges are more common. But as far as providers, we find that 40% of the non-participating doctors are typically mental health providers. Then there's also some chiropractors, since Medicare only covers one chiropractic service. We've seen dermatology, and on occasion, anesthesiology groups, though this is becoming less and less common each year. Now, the anesthesiologists create a unique concern because you often don't know who your anesthesiologist is until the day of a surgery. And this is where an important observation applies. Most physicians groups require that all the physicians in that group accept a Medicare assignment. And this is done for consistent billing. So you don't necessarily need a name. You only need the group or the practice name, which you can look up in advance. You call that office and confirm that all the doctors associated with that office accept Medicare assignment. Now, to be double sure, you can also call the surgery center, explain that you are a Medicare patient and you will only accept an anesthesiologist that accepts Medicare assignment. And make sure they take a note of that, and they will. Now, the odds of this being an issue are very, very small. In addition, if there is an excess charge, the actual excess charge is likely to be somewhere between $60 and $180. It's enough to irritate you, but not enough to bankrupt you. So again, excess charges are not a crisis, but they're one of the rules that catches people off guard and often creates more fear than it deserves. So once you understand how it works, it's easy to plan around. It's even easier to eliminate entirely. If this video has saved you confusion or made you feel better about Medicare excess charges, please like the video and subscribe, and make sure that you don't miss out on the next videos that we'll have about all the different features of Medicare that are important to you. And even more, when you do press the like button or comment or subscribe, you're going to be helping people just like yourself that also have questions about Medicare. Because when you do that, Medicare will actually share this video out to people like yourself. So I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching, and I'll see you in the next video.